Welcome to Burnaid channel. Thank you for joining us. Today, we'll discuss a nursing care plan for the risk of aspiration, including strategies for prevention and management. Nursing diagnosis, risk of aspiration. Related to decreased consciousness, difficulty swallowing, neuromuscular dysfunction, and other factors as evidenced by dysphagia, gastroesophageal reflux, use of feeding tubes, and history of aspiration. Desired outcomes. 1. The patient will remain free from signs of aspiration during hospital stay, including respiratory distress, pneumonia, and other complications. 2. The patient will demonstrate techniques to prevent aspiration during eating and drinking, such as proper positioning, slow eating, and avoiding triggers. Nursing interventions and rationales. 1. Assess swallowing ability and risk factors for aspiration before initiating feedings or medications, using standardized tools like the Mann Assessment of Swallowing Ability, MASA. Rationale: early identification of risks guides preventive measures to minimize the likelihood of aspiration. 2. Elevate head of the bed 30 to 45 degrees during feeds and for at least 30 minutes after feeding, utilizing gravity to prevent regurgitation and minimize risk. Rationale: reduces risk of aspiration by preventing stomach contents from flowing into the lungs. 3. Provide nursing interventions and rationales. Small, frequent meals and thicken liquids if necessary based on dietary recommendations, making it easier to control and swallow. Rationale: thicker liquids reduce the risk of aspiration by decreasing the speed of swallowing. 4. Monitor for signs of aspiration, such as coughing, choking, wheezing, or changes in breathing pattern during meals, and intervene promptly. Rationale: prompt identification and intervention prevent complications associated with aspiration. 5. Educate patient and caregivers on proper feeding techniques, positions, and signs of aspiration. Nursing interventions and rationales. Empowering them to take active roles in prevention. Rationale: knowledge enhances patient and caregiver confidence in managing nutritional needs while minimizing risk. Evaluation. 1. The patient will exhibit no symptoms of respiratory distress or pneumonia related to aspiration, demonstrating effective prevention and management. 2. Caregivers will demonstrate competency in managing the patient's nutritional needs while minimizing risk, showcasing understanding and application of prevention strategies. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burnaid app for free from the Play Store or App Store for answers to more than 3,000 questions.